the essence of the conference is actually to talk about advancement and development that are not only limited to certain areas. So if you go into the conference, you have people talking about management in high income settings, in low income settings. And the reason is that even though they require the same treatment, access can be a problem. You could have easy access where you have the funding, but also you can have limited access where funding is an issue because of competing health demands. But among the very key advancements that actually we're talking about here is curative therapy. We're talking about curative therapy, that is like bone marrow transplantation and gene therapy. Bone marrow transplantation has been on for a much longer period of time, but gene therapy is just coming on, and we're just waiting actually probably for an announcement whether that gene therapy will be approved in the UK. But hydroxyurea is one of the treatments that has been available, and that is available universally. I want to make sure that we can increase that utilization in Africa. But the other thing that we're really working on in terms of progress in sickle cell disease is to improve newborn diagnosis. Okay, this is what I mean is that because if they are born with sickle cell disease and one doesn't know they have sickle cell disease, and there will be no clear focus to make sure that you look after them. But if we can offer diagnosis, early diagnosis, then we'll be able to help parents, families, and members within that kind of health system to support their treatment. The reason why I mentioned mainly about sickle cell disease, you're quite right, is because sickle cell disease is one that's more in countries like Africa, Nigeria, but thalassemia is actually very high in Egypt, very high in Lebanon. So thalassemia, there are less numbers in terms of numbers in the UK. We have about less than under 1,000, whereas in sickle cell disease we have about 17,000 with sickle cell disease in the UK. But the focus on thalassemia, they are similar conditions because they all have anemia, and they also have iron overload. So iron is excess, and they need to remove those iron by different types of treatment. And both of them also have similar response to bone marrow transplantation and similar response to gene therapy. So that's why sometimes we deal with them together. But sometimes advancement in one area actually can benefit the area, particularly advancement in iron removing agents or chelation therapy, advancement in bone marrow transplantation, gene therapy. They actually can benefit both conditions. So that is because of the way thalassemia presents. It presents more uniformly than sickle cell disease. So you can easily know exactly what you need to do for thalassemia. So you can say, okay, I'm going to offer them very high risk treatment like gene therapy, bone marrow transplantation. Whereas in sickle cell disease, you have to select who is it that you offer that kind of treatment to.